Hello, my name is Giselle Bowie. This is Epidemiology and Healthcare Administration, MHA 612. Today I will be discussing the spread of measles in several states and how it has affected many people in different states. The measles running rampant at an alarming rate has been the topic of discussion in many states throughout healthcare platforms and throughout many schools where some children are unvaccinated for personal reasons and religious reasons as well. The introduction of epidemiological investigation. As I mentioned earlier, the measles outbreak has swept the world by storm. It is a virus that is contagious and can affect those who are unvaccinated, predominantly children. And the states affected now are California, Texas, New York, and Florida. Some of the symptoms that the CDC is keeping a close eye on is pink eye, runny nose, rashes on certain parts of the body, kids sneezing, coughing that can last for several days, and just watching the spread of how fast it is increasing at an alarming rate. Measles typically takes 7 to 10 days before you start to see symptoms evolve, and it is airborne. The determinants of health are people in low poverty communities not having accessibility to vaccines, clinics, hospitals, annual health visits, healthcare insurance, immigrants, and so many other issues where people are left unvaccinated to protect them against the measles have a huge impact on the spread of measles. People traveling from all over the world to certain countries, and they are unvaccinated, and they carry the measles virus with them and spread that virus throughout the world, where those are less fortunate are affected greatly by the spread of measles. So with the help of the CDC and a plethora of healthcare entities are able to keep track of the spread of measles, new symptoms, and gives us a better visualization of how the measles virus is spread and how to spread the word on the importance of becoming vaccinated and reducing the spread. As the CDC addressed root causes that perpetuate disease vulnerability, it helps us in a great way to gain access to health care to avoid these things from happening, as such as spreading viruses and getting viruses and spreading them to other people who are left unvaccinated for whatever reason, whether it's through health care, social determinants, or just living somewhere where you don't have the accessibility to these vaccines. And for religious beliefs, personal beliefs, just showing the world how important it is to be vaccinated to protect you against these viruses. And their family, you want to protect your family against the spread of these viruses. So it's great to focus on these social determinants of health. It gives us more of a complete picture than just tracking case numbers. It allows people to see what's really going on in real time and how this issue can be combated and addressed appropriately. As we look at the research elected in the epidemiological study for several compelling public health reasons, the severity of this virus, and as I mentioned earlier, to prevent it from a broader systemic and social health point of view, it's important. It's so important to shed light on something that has affected people in a vast way